all the time in many contexts legal, political, even in the song lyrics. The term red tape refers to rules or regulations to which we must adhere. More specifically, rules and regulations are called red tape when they are deemed to be excessive and therefore prohibitive to action or productivity. The phrase cut through red tape is often used in situations when someone would like to do away with bypass or otherwise get around statutes. So, where does it come from? Is there some symbolism in the use of red and white tape? To find out, we have to go back to 1500s. Let's talk about the red tape. I am talking about King Charles V of Spain. In 16th century Spain, the cabinet of King Charles V got a facelift. With a massive empire to rule, he needed a way to prioritize all the matters involved in running a monarchy. His administration developed a system in which the most urgent legislations, issues, and other documents were wrapped with a red ribbon or cloth. All others were simply tied with ordinary string. By distinguishing all bureaucratic matters in this way, the government was able to operate more smoothly and efficiently. Apparently, ribbon system worked so well that the leaders and the legislators across Europe began implementing it as well. Okay, let's talk about the modernization of red tape. Centuries after the red tape tradition was instituted, many 19th century authors popularized the term, making it accessible to the common man. In 1850, Charles Dickens used the term red tape in David Copperfield.
He wrote, "Britannia, that unfortunate female, is always before me like a trussed fowl, skewered through and through with office pens and bound hand and foot with red tape."
Red tape refers to any type of regulation or official procedure that causes delays or increases costs. Red tapism is an extension of this concept. It refers specifically to regulations that create unnecessary obstacles for businesses or healthcare providers while they are trying to provide services or make money. Red tapism creeps into any management system and lead to a process-centric environment where rules are followed, but the end goal forgotten. The term originates from the practice of red tape, which literally means delays in business dealings. Example of this includes free movement of goods through the customs, the delay in appointments for patent treatments, and the lack of progress in approvals for business activities.
अस्सलाम वालेकुम। मेरा नाम प्रोफेसर डॉक्टर गुलाम मुर्तज़ा गोंदल है। मैं फौजी फाउंडेशन हॉस्पिटल में प्रोफेसर ऑफ मेडिसिन हूँ और शाम को मुर्तज़ा मेडिकल कम्प्लेक्स बैरियर टाउन फेज़ 8 रावलपिंडी में बैठता हूँ।
How efficient systems and decentralized decision making benefits me?
We have got data of our patients, we have got lab reports of our patients, and we have got online system of checking reports of our patients. So our patients can give samples here and then they can download their report, they can check their report, they can take our appointments from our software, they can give suggestions and feedbacks to our online system.
Sir, do you think reduction in paperwork, long procedures will improve the business growth and eventually economic growth of Pakistan?
Yes, definitely, because papers are difficult to handle, difficult to save, and difficult to keep records. But when you put your all data on online systems and you use that data, and definitely we can achieve our previous data. For example, I can have my checkup, I can have my medicine which I have prescribed to my patients last 6 months ago, 1 year ago. So I can check my patient's progress, I can send them some suggestions online. Yes, definitely. When there is because today is the era of online, everything is online. So we cannot go behind the rest of the world. So in all big hospitals, in all big institutions, there are online systems, and online system one can, for example, I am sitting here and I can check my whole of this reports, or what's going on in the lab, what's going on the upper floor, what's going in the other systems, how many patients are coming, what is today's progress. So I can check each and everything. I can check my patients data, I can check my accounts, I can make some audit of my all this hospital.
Red tape lies behind the bad healthcare delivery system, poor medical services, and poor business competitiveness in many countries. It may raise the overall cost, become time consuming for the business or the institute, it hinders patient care, moreover, it acts as a barrier to the economic growth.
Here are the solutions to avoid red tapeism. We can improve our technological system and by reconsidering the steps and procedures of the corporate. Motivational workshops are very useful to hinder the disadvantages of red tapeism. Hospitals can prioritize red tape cutting initiatives to simplify administration. If red tapes are extended beyond organization, coping strategies can be focused to improve productivity. Last but not least, artificial intelligence tools. According to the Harvard Business Review, using AI powered tools can reduce cost, administrative hours, and overall system efficiencies.
President Trump has succeeded in reducing some federal regulations, but odds are you haven't noticed a difference in your daily routine. In fact, there's so much bureaucracy, so many processes, rules, and procedures in virtually every facet of what we do, it may be among the most persistent and vexing challenges in American life. That's today's cover story, Drowning in Red Tape.
1960, there were approximately 20,000 pages in the Code of Federal Regulations. Today, there are over 185,000 pages.
President Trump promised that for every new federal regulation issued on his watch, 2 would be cut. His first year exceeded that. 22 old regulations were cut for each one added.
1, 2, 3.
Australia has a red tape crisis, and it's the red tape you can't see that's making the problem worse. I've released a new research paper for the IPA on what I call regulatory dark matter. Here's what I've found. Red tape costs Australia $176 billion every year, and it can be easy to track when the red tape is being created by government through laws and regulations. But regulatory dark matter is harder to track, and here's why. The government delegates the power to make regulations to different regulatory bodies. These bodies make new regulations and publish guidance material and notices. which, although unofficial, have a real regulatory effect. Because these regulatory actions aren't debated in Parliament and aren't covered by the media, we don't see them. That's why I call them dark matter.
How much time and frustration do you think red tape costs us in our daily lives?
You know, I'm afraid that we may be very used to it and that we don't notice it quite as much.
Diane Katz is a senior research fellow in regulatory policy, red tape, at the Conservative Heritage Foundation.
This isn't a partisan issue. This is a political issue because administrations on both sides of the aisle have wasted no time in, getting their own regulations out there.
In Tales of the Red Tape, Katz has chronicled examples like federal regulations requiring hotels, restaurants, and airlines to write policies accommodating miniature horses as service animals. Like the government's idea to streamline the home mortgage process. The supposed fix was nearly 1,100 pages long.
Every element of our lives is regulated. The food we eat, the clothes we wear, how we light our homes, how we cook, the toys our kids play with, the volume of our television, the size of our breath mints. I mean, you name it, it's regulated.
You co-authored a report that tried to quantify the costs and the amount of bureaucracy.
Well, first of all, no one keeps track of the total cost of regulation. What we did is we quantify on an annual basis the number and the cost of the major regulations that are added in a given year. And we found that over the Obama administration, there was about $120 billion of new regulatory costs, new ones, not the existing ones.
Per year or over time?
Per year. That's on top of estimates of about $2 trillion in costs.
Some rules are necessary, some regulations are needed, am I wrong?
There's always good intentions for everything in Washington, but that doesn't mean that the results are good. And sometimes the intentions are supposedly good, but behind them there are political and economic drivers. And so I wouldn't necessarily say that every regulation comes from a good intention.
With the pharma industry since almost last 28 years. Again, we have a proper system. As far as the pharmaceutical industry is concerned, it's a very regulated industry. इसमें from the manufacturing, from the starting of the material to the end consumer, जो कि आपका patient है, उस पूरी चीज़ को control किया जाता है. If we receive any complaint even from the customer, then we have to review all the processes. We have very strong systems called recalls. कोई product खराब होती है तो recalls हो जाते हैं. तो systems are there, software are there, जो कि आपकी चीज़ों को control करते हैं for the patient, for the cost effectiveness. Of course, आप multinational की products लेते हैं वो महंगी होती है. National की भी as good as the multinational. They are cost effective. Systems are always there, और recall system मौजूद होता है हमारा if there is anything goes wrong. Yes, artificial intelligence. Yes. पेपर डे बाई डे महंगा हो गया है. पहले तो आई डोंट नो जो आपका A4 का आता था सस्ता था, बहुत महंगा हो गया है. लॉन्ग प्रोसीजर्स इन द फार्मास्यूटिकल इंडस्ट्री देयर इज नो लॉन्ग प्रोसीजर्स. एफिशिएंसी इंप्रूव हर जगह करनी होती है. फार्मास्यूटिकल में प्रोसीजर सेट्स होते हैं, उन्हीं को आपको फॉलो करना होता है. यस, आप कह सकते हैं इम्प्रूवमेंट, एफिशिएंसी के ज़रिए इम्प्रूवमेंट की जा सकती है, वेस्टेजेस को कंट्रोल किया जा सकता है। जैसे कि एक जर्मन टर्मिनोलॉजी से लीन मैन्युफैक्चरिंग, लीन मैन्युफैक्चरिंग इज़ बेसिकली अ पार्ट ऑफ कॉस्ट कटिंग। तो लीन मैन्युफैक्चरिंग के कॉन्सेप्ट यूज़ किए जाते हैं फार्मास्यूटिकल मैन्युफैक्चरिंग यूनिट्स के अंदर, बाकी जगह किए जाते हैं। तो इस तरह के हम चीज़ों को कंट्रोल करते हैं। कॉस्ट कटिंग के लिए वी यूज नॉर्मली लीन मैन्युफैक्चरिंग। फिर हम KPIs बनाते हैं। KPIs का अगर आप लोग जानते हैं की परफॉर्मेंस इंडिकेटर्स होते हैं, ठीक है, और विच आर पार्ट ऑफ द ऑब्जेक्टिव ऑफ द इंडिविजुअल्स, ऑफ द डिपार्टमेंट्स एंड ऑफ द कंपनी।
Every country strives to enhance business productivity and improve the healthcare sector. Our healthcare sector suffers from various administrative issues, impediments, and inefficient processes, which mounts pressure on the doctors and the whole staff. As a result, they get caught between patient care and meeting administrative deadlines. It is more common in public hospitals as compared to the private hospitals. It takes lots of efforts to cut the red tapes deep-rooted in our system. If we want to upgrade healthcare services in our country, we should take initiatives on cutting the red tapes on organizational as well as on the government level so that the quality healthcare becomes accessible to all.